Republicans, as everybody know, controls the U.S. Senate, controls the U.S. House, and controls the White House. In other words, they are running the government. But what is happening now, which has never happened before, is they are not sitting down and negotiating. So as of this point, Democrats have had no input into the process at all. Now, what Republicans want is to pass what is called a clean CR. In other words, maintaining the status quo. Here's why that is an awful idea and why all of us are opposed to that. In the last year, as many of you know, under Trump's big, beautiful bill, 15 million people on Medicaid and the Affordable Care Act will be thrown off of health care. Very shortly, you are going to be receiving notices from your insurance companies that your rates, your insurance premiums, are going up by, on average, some more, some less, 75%. Yeah, you heard that correctly, 75%. Now, right now, we have a broken healthcare system. Nobody can afford healthcare. You're ready for a 75% increase in your insurance premiums. You're not, nobody is.
But in Vermont, a Vermont family making $82,000 family afford, their premiums can go up $20,000 a year.
We want to protect access to health care for millions of people across this country. And we're willing to get in the fight for that because we've had it.
The priorities that we have at the table, and they need Democratic votes in order to keep the government open, man, they're pretty reasonable. They're pretty reasonable. What are we asking for? Just don't increase people's premiums by 75%.
Your grocery bills are going up, your utility bills are going up, and your healthcare costs, especially health insurance premiums, are going through the roof.
Who voted to repeal all of these Medicaid and Affordable Care Act, Medicare, and NIH, funding? Republicans.
We're for a proposal that keeps the government open. But we also don't want to give Donald Trump, a lawless president, a blank check.
Save healthcare and save our republic. Those are our two missions.